Welcome to Fresh Thinking School of Brain Science, the spark of hope. Brain stimulation therapies ignite hope for individuals battling neurological disorders, offering a potential path towards improved neurological function and quality of life. By precisely targeting brain activity, these treatments show promise in reducing symptoms and improving quality of life for conditions like Parkinson's and epilepsy. Early results are encouraging, suggesting a future where brain stimulation plays a crucial role in neurological care. Brain stimulation therapies hold immense potential for revolutionizing the treatment of neurological disorders. By directly modulating neural activity, these therapies offer targeted relief for conditions like Parkinson's disease, epilepsy, and even Alzheimer's. Unlike traditional medications, brain stimulation can precisely tailor to individual needs, minimizing side effects. It delivers electrical or magnetic impulses to specific brain regions, non-invasively, or through implanted electrodes. While research is ongoing, early results are promising, showing improvements in motor function, seizure reduction, and cognitive enhancement. Brain stimulation could become a cornerstone of neurological care as technology advances, providing new hope for patients and their families. Brain stimulation therapies represent a mushrooming frontier in the treatment of neurological disorders, offering hope and potential breakthroughs for patients with conditions that have long defied traditional medical interventions. By directly modulating neural activity, these therapies bypass the limitations of systemic medications and target the root of neurological dysfunction. This innovative approach, non-invasively, delivers electrical or magnetic impulses to specific brain regions through the skull or implanted electrodes. The effects are remarkable, ranging from tremor reduction in Parkinson's disease to seizure control in epilepsy, and even improvements in cognitive function in Alzheimer's disease. The appeal of brain stimulation lies in its precision and adaptability. Unlike drugs that affect the entire brain, stimulation can target specific neural circuits, minimizing side effects and maximizing therapeutic impact. Moreover, stimulation parameters can be adjusted in real time, allowing personalized treatment tailored to each patient's unique needs and responses. While brain stimulation has immense potential, the research is ongoing to fully understand its mechanisms and action and long-term effects. Clinical trials are underway to explore its applications in a broader range of neurological disorders, including stroke, traumatic brain injury, and chronic pain. The future of brain stimulation in neurology is bright as technology advances and our understanding of brain deepens. We can anticipate more sophisticated and effective stimulation techniques. This, coupled with ongoing research into biomarkers and personalized treatment protocols, promises to revolutionize how we manage neurological disorders, offering new hope and improved quality of life for millions of people worldwide. There are 7 potential strategies of brain stimulation for treating neurological disorders. Personalized treatment protocols. The effectiveness of brain stimulation therapies hinges on recognizing the unique nature of each neurological disorder and tailoring treatment plans to the individual patient. This personalized approach acknowledges that no 2 brains are identical, and even within the same disorder, there can be significant variations in severity, affected brain regions, and responses to stimulation. A comprehensive assessment is the first step in developing an individualized treatment plan. This involves thoroughly reviewing the patient's medical history, current symptoms, and diagnostic imaging to identify the specific brain areas involved in the disorder. The condition's severity is also considered, as it may influence the type and intensity of stimulation required. Another crucial factor is the patient's unique brain anatomy. Subtle variations in the location and connectivity of neural circuits can significantly impact the effectiveness of brain stimulation. Advanced neuroimaging techniques such as functional magnetic resonance imaging, fMRI, and diffusion tensor imaging can provide detailed maps of the brain structure and connectivity, allowing clinicians to tailor stimulation parameters to the individual's anatomy. Monitoring the patient's response to stimulation is equally important. As the brain is a dynamic organ, its response to stimulation can change over time. Regular assessments and adjustments to the treatment plan are necessary to optimize outcomes. This may involve adjusting the intensity, frequency, or duration of stimulation based on the patient's feedback and observed symptom changes. By embracing this personalized approach, clinicians can maximize the therapeutic benefits of brain stimulation while minimizing potential side effects. This allows for a more targeted and effective treatment that takes into account each patient's unique characteristics and specific neurological condition. This tailored approach improves patient outcomes and enhances the overall quality of care. Combining therapies. While a promising therapeutic tool, brain stimulation may not be a stand-alone solution for all neurological disorders. To maximize its potential and optimize patient outcomes, exploring the synergistic effects of combining brain stimulation with other treatment modalities such as medication, physical therapy, or cognitive rehabilitation is crucial. Medications can play a vital role in managing the underlying causes of neurological disorders, such as neurotransmitter imbalances or inflammation. Brain stimulation can complement these effects by modulating neural activity, enhancing neuroplasticity, and promoting functional recovery. For instance, in Parkinson's disease, Combining deep brain stimulation with medication can improve motor symptoms and reduce medication dosage, thus minimizing side effects. Physical therapy is often essential for improving motor function, strength, and coordination in patients with neurological conditions. Brain stimulation can augment the benefits of physical therapy by priming the brain for learning and facilitating motor relearning. This combination approach can accelerate rehabilitation and promote long-term functional gains. Cognitive rehabilitation aims to improve cognitive skills such as memory, attention, and executive function, often impaired in neurological disorders. Brain stimulation can enhance the effectiveness of cognitive rehabilitation by modulating brain networks involved in these processes, thereby facilitating learning and neuroplasticity. This combination approach can significantly improve cognitive function and overall quality of life. By exploring the synergistic effects of combining brain stimulation with other treatment modalities, we can develop comprehensive and personalized treatment plans that address the multifaceted nature of neurological disorders. This integrated approach can lead to enhanced outcomes, faster recovery, and improved quality of life for patients. The key is to identify the optimal combination of therapies for each individual based on their specific needs and underlying mechanisms of their condition. Technological advancements. Substantial investments in research and development is paramount to fully unlock brain stimulation's transformative potential in treating neurological disorders. This investment aims to refine existing technology, pioneer innovative solutions that will revolutionize the field of neuromodulation. Neuromodulation refers to the alteration of nerve activity through targeted delivery of stimulus, such as electrical stimulation or chemical agents, to specific neurological sites in the body. The goal is to normalize or modulate nervous tissue function. One critical area of focus is the development of more precise targeting methods. While effective, current brain stimulation techniques often lack the granularity to pinpoint specific neural circuits accurately. By investing in research, scientists can develop advanced imaging techniques and computational models that provide detailed maps of the brain's intricate networks. This will enable clinicians to deliver stimulation with unprecedented precision, targeting only the areas implicated in a particular disorder, thereby minimizing off-target effects and maximizing therapeutic impact. Another crucial frontier is real-time monitoring of brain activity during stimulation. Current protocols often rely on predetermined parameters with adjustments made after evaluating the patient's response. By incorporating real-time neuroimaging and electrophysiological monitoring, clinicians can observe the brain's immediate response to stimulation and fine-tune parameters on the fly. This dynamic approach ensures that the stimulation is constantly optimized for maximum efficacy and minimizes the risks of adverse effects. The development of closed-loop systems represents the pinnacle of personalized brain stimulation. A closed-loop system, also known as a feedback control system, is a system that continuously monitors its output and uses feedback to adjust its input in order to maintain a desired output. The feedback loop enables the system to self-correct and adapt to changes, leading to improved accuracy, stability, and robustness. These systems continuously monitor brain activity and automatically adjust stimulation parameters based on the individual's real-time needs. This creates a feedback loop where the brain and the device communicate, resulting in a highly tailored and adaptable and adaptive treatment experience. For instance, in Parkinson's disease, a closed-loop system could detect the onset of motor symptoms and adjust stimulation accordingly, providing optimal symptom control while minimizing side effects. Investing in these research and development initiatives is not merely an option, but a necessity. It is the key to unlocking the full potential of brain stimulation, leading to more effective, personalized, and responsive treatments for a wide range of neurological disorders. The ultimate goal is to improve the lives of countless individuals by restoring function, alleviating suffering, and enhancing overall well-being. Long-term outcome studies. Comprehensive longitudinal studies, meticulously tracking patients over extended periods, are imperative to fully comprehend the impact of brain stimulation therapies on neurological disorders and to assess these innovative treatments' long-term efficacy and safety. Firstly, longitudinal studies shed light on the enduring effects of brain stimulation on disease progression. By monitoring patients over time, researchers can determine whether these therapies merely provide temporary relief or alter the course of the disease. This information is crucial for clinicians and patients when deciding on the most appropriate treatment approach. Secondly, assessing the impact of brain stimulation on patients' quality of life is paramount. Neurological disorders often significantly impair daily functioning and overall well-being. Longitudinal studies can track changes in patients' physical and cognitive abilities, emotional state, and social engagement, providing a comprehensive picture of how these therapies influence their lives beyond symptom management. Thirdly, these studies are essential for identifying and monitoring potential side effects. While brain stimulation therapies are generally considered safe, there is always a risk of adverse events, especially with long-term use. By following patients over time, researchers can detect any delayed or cumulative side effect, ensuring the safety and well-being of those undergoing treatment. Furthermore, longitudinal studies can help identify factors that predict treatment response and long-term outcomes. This knowledge can guide clinicians in tailoring treatment plans to individual patients, optimizing efficacy and minimizing risks. By understanding which patients are most likely to benefit from brain stimulation, we can ensure that these therapies are used most effectively. To put it briefly, longitudinal studies are indispensable in evaluating brain stimulation therapies, long-term efficacy, and safety for neurological disorders. By tracking patients over extended periods, we can gain valuable insights into the impact of these therapies on disease progression, quality of life, and potential side effects. This knowledge is essential for making informed decisions, refining treatment protocols, and improving the lives of individuals with neurological conditions. Biomarkers identification. The quest to optimize brain stimulation therapies for neurological disorders hinges on identifying reliable biomarkers. These measurable biological indicators hold the key to predicting how individuals will respond to treatment and enabling personalized customization of stimulation parameters. By identifying these signposts, clinicians can tailor interventions to each patient's unique profile, maximizing therapeutic efficacy and minimizing potential risks. Neuroimaging techniques such as functional magnetic resonance imaging and electroencephalography offer a window into the brain's intricate workings. Analyzing patterns of neural activity can unveil biomarkers that correlate with treatment response. For instance, specific brain regions might exhibit distinct activation patterns in individuals who respond favorably to specific stimulation protocols. By recognizing these neural signatures, clinicians can optimize treatment parameters, enhancing the likelihood of positive outcomes. Genetic testing provides another avenue for biomarker discovery. Variations in specific genes can influence an individual's susceptibility to neurological disorders and their response to brain stimulation. By analyzing a patient's genetic profile, clinicians can identify markers that predict treatment efficacy and tailor stimulation accordingly. This personalized approach ensures that each patient receives the most suitable and effective treatment regimen. Beyond neuroimaging and genetic testing, other measures can contribute to biomarker identification. These may include blood tests that assess levels of neurotransmitters or inflammatory markers, cognitive assessments that evaluate specific mental functions, or wearable devices that track physiological data like heart rate variability. Integrating information from these diverse sources can provide a comprehensive understanding of each patient's unique biological landscape, facilitating precise and personalized brain stimulation therapies. Identifying reliable biomarkers represents a paradigm shift in the field of brain stimulation, moving away from a one-size-fits-all approach towards personalized medicine can optimize treatment outcomes, minimize adverse effects, and ultimately improve the lives of individuals with neurological disorders. This quest for precision medicine through biomarker identification is not just a scientific endeavor, but a promise of hope and healing for countless patients and their families. Patient education and engagement. Empowering patients with comprehensive and transparent information about brain stimulation therapies is imperative to maximizing their potential and fostering a collaborative approach to healthcare. This empowerment involves equipping individuals with a deep understanding of brain stimulation's potential benefits, risks, and limitations, enabling them to make informed decisions about their care and actively participate in the treatment process. Providing patients with comprehensive information begins with clear and accessible explanations of the different types of brain stimulation therapies available, their work mechanisms, and the specific conditions they are designed to treat. This information should be presented free from medical jargon and tailored to the individual's level of understanding. It is also crucial to discuss the potential benefits of these therapies, such as improved motor function, reduced tremors, or decreased seizure frequency, while acknowledging their limitations and potential risks, including side effects like headaches or mood changes. Empowering patients also fosters open and honest communication between patients and healthcare providers. Clinicians should encourage patients to ask questions, express concerns, and share their expectations for treatment. This dialogue creates a collaborative environment where patients feel heard and respected, leading to shared decision-making and improved treatment adherence. Furthermore, providing patients with educational resources such as brochures, websites, or support groups can further empower them to make informed decisions. These resources can offer additional information about brain stimulation therapies, connect patients with others who have undergone similar treatments, and provide a platform for sharing experiences and coping strategies. By empowering patients with comprehensive information and fostering open communication, we can ensure individuals actively participate in their healthcare journey. This approach not only improves patient satisfaction and adherence to treatment, but also leads to better outcomes and a more positive overall experience for individuals with neurological disorders. Collaboration and knowledge sharing. Fostering collaboration among diverse stakeholders is paramount to fully harnessing the potential of brain stimulation therapies and driving innovation in this rapidly evolving field by creating a collaborative ecosystem that unites neurologists, neuroscientists, engineers, and other healthcare professionals can accelerate the development and implementation of effective brain stimulation treatments for neurological disorders. Neurologists, with their clinical expertise and understanding of neurological conditions, play a crucial role in identifying potential applications for brain stimulation and evaluating its effectiveness in real-world settings. Their insights into patient needs and treatment outcomes guides research and development efforts. With their deep knowledge of brain function and neural circuits, neuroscientists can provide fundamental insights into the mechanisms underlying neurological disorders. Their expertise in neurophysiology and neuroanatomy is essential for designing and optimizing brain stimulation protocols that target specific brain regions and networks. With their technical skills and ingenuity, engineers are instrumental in developing and refining the hardware and software required for brain stimulation. Their electronics, signal processing, and device design expertise are crucial for creating safe, effective, and user-friendly brain stimulation devices. Other healthcare professionals such as psychiatrists, psychologists, and rehabilitation specialists can contribute their unique perspectives and expertise to the collaborative effort. Their insights into the psychological and social aspects of neurological disorders can help ensure that brain stimulation therapies are integrated into comprehensive treatment plans that address patients' holistic needs. By fostering collaboration among these diverse stakeholders, we can create a vibrant ecosystem where knowledge, expertise, and resources are shared freely. This cross-disciplinary approach can lead to the rapid development and implementation of innovative brain stimulation therapies, ultimately improving the lives of countless individuals with neurological disorders. In conclusion, the potential of brain stimulation therapies for treating neurological disorders marks a significant advancement in modern medicine. This innovative approach, targeting specific neural circuits and modulating brain activity, offers hope for patients without relief through traditional treatments. While still in its early stages, brain stimulation has demonstrated remarkable efficacy in managing conditions like Parkinson's disease, essential tremor, and epilepsy, improving motor function, reducing seizures, and enhancing quality of life. The non-invasive or minimally invasive nature of many brain stimulation techniques makes them appealing alternatives to more invasive surgical procedures. They also offer the advantage of being adjustable, allowing personalized treatment plans tailored to each patient's unique needs and responses. However, further research is imperative to optimize protocols, identify ideal candidates, and mitigate potential risks and side effects. As our understanding of the brain's intricate networks deepens and technology advances, brain stimulation therapies are poised to revolutionize this treatment landscape for neurological disorders. These therapies can restore lost function, alleviate debilitating symptoms, and improve overall well-being. It is a testament to the power of scientific inquiry and the unwavering pursuit of innovative solutions for some of the most challenging medical conditions. Looking ahead, the future of brain stimulation and neurology is bright. With continued research and development, we can anticipate a more comprehensive range of applications, more refined techniques, and improved patient outcomes. By harnessing the brain's own plasticity and adaptability, we can unlock new avenues for healing and pave the way for a brighter future for individuals with neurological disorders. This is Dr. Masasikani Mishakosa, Director of the Fresh Thinking School of Brain Science. We really appreciate you coming over. If you're not subscribed to this channel, we encourage you to do so, because we are committed to give you the very best scientific analysis on the brain and other topics. Thank you for coming around. Really appreciate that. Thank you.